Okay, welcome everyone to the first Region 4 Planning and Policy Council meeting of 2022. It's nice to see everyone. It looks like we have 25 individuals on the call, so thank you all for taking time out of your day to join us. I know we have a very important, busy meeting this morning with the needs assessments coming up. Your chair, Shara, will be with us here shortly. She had another meeting prior to this, but we have Angie and Rusty on the call. So just a few things to go over. As you can see, we're still meeting virtually. This is per the Open Meetings Act. With the new COVID variant going around that's highly contagious, Regional Council leadership voted to continue the virtual meetings, continue the virtual meeting format in order to keep everyone safe. And it's something that we will discuss every quarter. And the top priority is always to make everyone safe. So I just wanted to let you all know that. With that being said, this meeting is being recorded and it will be posted to the department website within the next day or two. So please make sure your phones and or computers are muted. If you're not speaking, it just prevents any feedback from coming through. And please also make sure you state your name before presenting or asking a question. It's helpful when capturing the minutes. So something before I hand it over to Angie, something we're doing differently for this meeting and meetings moving forward as they meet virtually is the way that we vote on minutes. So you should have all received the minutes from November 2021 in your email. And hopefully you've all had a chance to review them. So in the past, we would just do a motion to approve in a second. But what we are going to do for this meeting is I'm going to go ahead and go through roll call. And when I state your name, if you could please tell me, state yes, no, or abstain as it pertains to the minutes. Obviously, if you vote no, please let us know why you vote no if we need to edit the minutes in any way. If you are an MCO or a member of the department, you must abstain from voting on the minutes. So Rusty, if you don't mind, if you can take, when you're writing down the names of the attendees, if you can write what their vote is next to their name and tally it up for me, that would be very helpful. Oh, here's Shara.
Will do.
Okay, so I'm going to go ahead and go through everyone's votes, or everybody's name. I'm sorry, if you could just state your vote after I state your name, okay? Like I said, my name is Kirby Fye. I'm with the department. I'm abstaining from the vote. Steve Shates. Steve Shates, can you say yes, no, or abstain?
I'm sorry, Ms. Kirby. This is actually Will Taylor.
Oh, hi, Will.
Faith-based community coordinator. For some reason, I guess it's still Steve was our past Lifeline coordinator. So
good to know. Nice to have you. Okay, Will Taylor, can you state yes, no, or abstain as it pertains to the minutes?
I'm going to abstain.
Okay, thank you. Avis Easley with the department, abstain. Dalma Sanchez, yes, no, or abstain?
Yes.
Thank you. Bridget Delbaccio, yes, no, or abstain? Bridget? I'll come back to her. Dawn, I know I'm going to butcher your last name. Can you state your last name for me?
It's Liacano, and it actually is misspelled in the minutes. I meant to email you.
Okay, back. So
it is the spelling is Loiacano.
Thank you. And with that change, do you vote yes, no, or abstain?
Yes.
Thank you. Elliot Pinsley?
Yes.
Thank you. Evelyn Jurgen?
Yes.
Thank you. Haley Hershey?
Yes.
Thank you. Kubra or Cal Bryant?
Abstain.
Thank you. Kurt Hippel with the department, abstain. Larry Brown.
Yes.
Thank you. Maria Smith. Maria.
Yes.
Thank
Can you
you.
hear me?
Yes, I can.
Okay. Yes.
Thank you. Natalie, what's your last name, Natalie?
My last name is Metzger.
Thank you. Yes, no, or abstain.
Yes.
Thank you. Michaela Poisner. Michaela, if I'm pronouncing it right, maybe I'm not pronouncing it correctly. Okay, we'll move forward. Rama Muhammad.
Hi, everybody. Yes.
Thank you. Robin Nobling.
Yes.
Thank you. Katie Schlotman.
Yes.
Thank you. Shara Biggs. Shara?
Hey, sorry, I couldn't get off mute. Yes.
Story of our lives. Thank
Right.
you. Stacy Yarbrough.
Yes.
Thank you. Susan Me.
Abstain because I missed the last meeting.
Thank you. Tammy Bass.
Yes.
Angie Thompson.
Yes.
Rusty Totten Emerson.
Yes.
Thank you. Tristan Petty.
Yes.
Did you say yes?
Yeah, I had to unmute. Sorry.
Thank you. Valerie Webb.
Yes.
Thank you. Is it Willie Ross? Am I saying that right? W. Sharon Ross. Oh, it looks like she might be away from her computer. Jules Wilson.
Yes, sorry, I can unmute.
Thank you. Okay, Rusty, what's the total?
Let me see. 2, 3, 4, 7, 8, 9. Looks like 21 yeses and 1 correction.
Okay, and his was a yes with the correction, so.
Yeah, Don's was the yes with the correction.
Yeah. Okay, is there a motion to approve? We only need one person.
So moved.
Oh,
Who was that? Was that
Sorry,
Elliot?
sorry, it was Ellie. I was just trying to help speed things along.
Thank you. And a second.
I'll do
Evelyn,
second.
was that you, Evelyn?
Okay.
Yes.
Yes.
Okay. So
Evelyn.
Elliot motion to approve, Evelyn seconded. We can move forward. Thank you all for your patience. Shara or Angie?
Hey, sorry, I was trying to print something. Nothing's working for me today. So thank you everybody for being here this morning. Let's see. So Kirby, when I got on, you were talking, but I didn't know, were you given the updates, the department updates?
No, I was just talking
Okay.
about the change in the approval of minutes is all.
Okay, awesome. So if you would like to go ahead with the department updates, that's what we've got next.
Sure, I could do that. Give me 1 second. Let me pull that up. Okay. So a few updates since we last met in November. The first update, something that we'll probably spend the entire meeting talking about, is the 2022 needs assessments. And I won't go into too much detail on this because we'll be talking about it later. But just a reminder that the worksheets are due to me via email on or before April 1st. I've also included a link to the Fast Facts portal, which is just there as a tool. It's on the department website, should just help you with the data piece, not required to use, just something that's available to you all if you need it when gathering data for your needs. And I'm here to answer any questions as it pertains to the needs assessments later. The FY21 Joint Annual Report is complete and it's been posted to the department website. The document can be found online, and I've also included a link, and I will share this update with Rusty for the minutes, so you'll have access to all these links. The department has selected a total of 10 programs across the state to receive $6.5 million in new funding to expand mental health services for children and youth. The new state funding was budgeted by Governor Lee and appropriated by the Tennessee General Assembly in the department's budget for state fiscal year 2022. In the department's announcement of funding, grantees were instructed to collaborate with community stakeholders, including local education authorities and other partners, to design proposals that would have the greatest impact and address outstanding needs. The selected proposals increase school-based services and respond to the increasing need for emergency psychiatric services for children and youth. The available funding under this announcement was divided proportionally among the department's 7 planning regions across the state, based on the number of children and youth living in each region. So I have a list of every region in here and who was awarded what funding, but I'm only going to focus on region 4, but you'll have access to view the other regions if you're interested in those. So region 4, Davidson County, Tennessee Voices, $623,000 to expand child care consultation with 2 new early childhood specialists and 2 family support specialists. In December 2021, the department in TennCare published the Public Behavioral Health Workforce Workgroup report. The document contains research, data, and strategies for addressing workforce challenges in publicly funded mental health and substance use services, some of which have already translated into state budget requests proposed to Governor Lee. Convened by the department in TennCare over the summer, the work group was comprised of diverse stakeholders from public behavioral health provider organizations, mental health and addiction advocacy groups, colleges and universities, and the department's statewide planning and policy council. Over the course of 3 meetings, participants identified gaps and needs in the public behavioral health workforce, developed detailed strategies for creating positive change, and authored the report for key decision makers. The report's recommendations focus on several key areas of impact, including provider reimbursement rates, licensure modifications, employee benefits and incentives, pipeline career planning, diversity and inclusion, student loan forgiveness, internship opportunities, and communicating to potential students. Budget proposals from the department in TennCare reflected high priority items from this work group. And in all, the agencies proposed $59 million in new state and federal funding to address these issues contained in the work group's findings. We can talk about this a little bit later as well. You may have, if you're a provider, you may have received an email as it pertains to the governor's State of the State address and funding that was budgeted for the department, which the workforce development was included in that. So that's pretty exciting. I know this was on the needs assessment for several years in a row in several regions across the state. But I wanted to talk about this because the report that was put together is included. I have the link included in here, and it's if you're interested in taking a look at it. And then last but certainly not least, the Tennessee Recovery Navigators are celebrating another successful year of delivering life-changing interventions for individuals living with addiction. The department is releasing a new annual report which details the program's successes despite a full year of pandemic-related restrictions. Tennessee Recovery Navigators use their own personal experience of addiction and recovery to talk with patients at Tennessee hospital emergency departments and try to connect them with treatment resources. The patients they have seen have recently overdosed, are experiencing active withdrawals, or have presented with a substance use disorder. In this annual report for state fiscal year 2021, the navigators were able to increase patient interactions up to 2,967. 76% of the patients were placed into treatment, and 4 hospitals were added for a total of 42 across the state. Now in their 4th year, the Tennessee Recovery Navigators have worked with more than 6,700 patients statewide. And I've included a link to on our department website for the Tennessee Recovery Navigators, which there's a recent video that was produced there to highlight all the accomplishments the Tennessee Recovery Navigators have seen across the state. And that's what I have. I tried to be quick with it. I know you have a lot going on today.
Thanks, Kirby. Yes, you were super fast. I had a hard time writing down everything you were saying.
Oh, you don't have to write it down. I send it.
I know. It's something, it's for my brain, trust me. But thank you. That was a lot of really great information. Does anybody have any questions real quick for Kirby? If it's pertaining to needs assessment, hold off, because that is a huge item on our agenda today. But anything else that you want to ask?
Hey guys, this is Kurt Hipple, and I just want to add to the great update that Kirby made. We had a children's committee meeting earlier this morning, and they had questions about the state of the state and the proposed budget from Governor Lee to the legislature for FY23. So I don't know if that's something that I certainly don't want to steal Elliot's thunder on the legislative report. But happy to answer those questions as they come up, or we can always wait for Elliot to hit the highlights.
All right, awesome. Thank you, Kurt. Let's see. So moving on, we've got the MCO reports. And I was trying to look, I keep trying to switch to the participant list, but do we have anybody here from Group?
I think we only have an individual from United Healthcare, Kubra, I believe. If I'm
wrong.
wrong.
Yes, I'm here. Yeah, Kubra, that's she was the only one that I remembered hearing. So if you'd like to go ahead with the UHC report.
Well, hi everybody. I'm still here. We'll be around for another few years, as you know. So we are supporting the community and all the events going on in the community. So if you have any needs, if you want to organize any events, and if you need help, we will be very happy to help you as a team and put events together, or also sponsor events for you. So please contact me if anything comes up in the community. We can work together.
Awesome. Thanks, Kubra. And just going once, going twice, anyone from Group or Blue Care that we've missed? Once, twice, and moving on to our committee reports. So we'll start with the Children's Committee.
Good morning, everyone. This is Susan Cope with the Tennessee Commission on Children and Youth. The Region 4 Children's and Youth Subcommittee meeting met on January 25th at 10 a.m. We had 13 in attendance. I want to thank Robin for putting together a survey of our needs assessments that were brought before the council members on that day. I will go over those with you and then tell you the results of the survey. The first one was an increase in the number of psychiatrists to work with children and youth who will take commercial insurance, pen care, and non-insurance. That was number one. Number two is increase the school childcare, increase after school childcare for children with disabilities and working parents. Increase the housing option for teenagers who have behavioral issues. create a youth crisis stabilization unit at the mental health cooperative, modeled on the adult unit, which will include respite stay. Create respite opportunities for parents of children with behavioral health issues. Increase partial hospitalization programs and intensive outpatient services in the community. And increase cultural sensitive training for staff engaged with the LGBTQI plus youth. And our survey results show that, let me make sure I get this correct. The number one need was increased after school childcare for children with disabilities and working parents for several hours. The second one was create respite opportunities for parents of children with behavioral health issues. And the third one was increase the number of psychiatrists to work with children and youth who will take commercial insurance, TennCare, and non-insurance. And I would ask Robin to chime in, or Marie, either one, and expand on anything they wish to expand on.
I think I will leave that for the most part to Maria. If she, are you on, Maria? It does not appear
Yes,
that. Good.
Robin, I am here, but go ahead and because you helped us out quite a bit with the conversation. I did notice, I will comment and say that we have a lot of education to do with the children and youth. I think before COVID, people knew about resources, so we need to refresh everybody's memory during COVID what those resources are. So we're going to have different people to come to our meeting to help us explain, make people aware of those resources.
Right. Well, and the other thing is within the Children's Committee, this is kind of new for folks in this committee, so they're not used to the process of looking at these up against the 3-year plan. That it was something that we did mention, but will be something that will have to be done in looking at all this good stuff, and so we'll have to take that measure to see where these how these particular, especially your top 3 measure up. I don't think, as I recall, both Susan and Maria, and I don't know if Marinike is on here, but I don't know that, I don't recall us really divvying these up between substance use disorder needs and mental health needs. And since the requirement now is to make sure you're equal on both sides, we will need to look at that as the committee goes further in developing the needs so that they can be turned in.
You are correct, Robin. We did not cover that.
Yeah, and we can. This is something we can follow up with as this gets more developed.
Does anyone have any questions that we could answer?
And can I give a shout out on behalf of the Children's Committee to say these needs are still, they're getting refined and developed. So anybody that has some input into them, I'm sure Susan or Maria would love to hear from you in doing that. So if you missed out and you can't do the Children's Committee, but you've got input into that and some insight on some things, that would be terrific. So be sure to get a hold of either Susan or Maria. And we did get, this might be a time when you guys want to share who your new co-chairs are.
Maria, do you want to share that?
Sure. Our new co-chairs are Marinike Murphy and also Francis Garcia with the Department of Health. And hopefully the next meeting they will all be present. And they are excited about it.
Nice.
Susan and Maria, I just want to thank you guys so much for what you've done with the Child and Youth Committee. Just in a short time, bringing it together and getting people involved, taking the lead. I just appreciate you guys so much.
Thank you very much.
Glad to help.
All right, and so now we will move on to the Adult Committee report. And I know I saw Evelyn and Valerie at one point.
Oh, here, this is Evelyn.
Hey.
Hi. Good morning, everyone. The adult committee did meet and looked at what we felt like some needs in Region 4 was around people with mental health diagnosis. Some of the things we've been looking at for a couple of years, and I guess we'll look at them until we can resolve some of the issues. But these are things that are back up to the 3-year plan. On the side, mental health side, we looked at, let's see, looking at engagement for people who have mental illness, some social engagements for them. Looked at some of the housing issues for people with mental health diagnosis, for the elderly as well as for the young adults, and how some ways we could look at supporting group homes to do wraparound services for those consumers that sometimes, yes, we're meeting their mental health needs, but they have other needs that need to be met, and group home has a shortage of staff. Just like everyone else in the agencies and with the state and everybody, there's a real big staffing shortage, and there's also a lack of resources to pay that staff. We looked at outpatient therapy and med management. We looked at educating support around trauma, especially within the law enforcement, and looking at how can we better serve people coming through the criminal justice center. Once they're discharged, what kind of housing do they need, and what kind of housing do we need for people who are registered sex offenders? That's very limited. We would like to see more peer support in housing, as well as agencies. More housing and supports for the dually diagnosis, looking at the people with the intellectual disabilities as well as the mental health disabilities. And looking at housing, we know we get support from the MCOs about developing some houses, people with some chronic needs, but for those who don't meet those criteria, looking for some housing for them that would meet the needs that they have. And anything else you can think of, Valerie? Or maybe she's not on anymore. But if anybody else that was in that particular session is something you can think of that I did not cover, feel free to chime in.
Yeah, it looks like Valerie did have to drop off. We do, which we'll discuss when we get to the needs assessment, but we did also have a survey and have those results with our top 3
Yes.
priorities on each side. So we'll be able to talk more about that too.
Yes. And I want to thank Robin and whoever assisted you with putting together the survey. It was wonderful. I think it will keep us on target. I appreciate that.
I second that as well. Yeah, very, very helpful. All right, and so moving on, we'll go to Elliot with the legislative committee report.
Thanks, Shara. Hello, everybody. And I'm Elliot Pensley with the Behavioral Health Foundation and Legislative Chair for Region 4. And I will try to keep this brief. There is a lot of news that I could share, but I'm going to be lightning speed because I know we've got lots to do. Our Legislative Committee for Region 4 last met on December the 2nd. And just want to go ahead and get this out of the way. Our next meeting is going to be March the 3rd at 1 o'clock in the afternoon on Zoom. Anybody who does not already get those invitations that would like to, please reach out to me after this. Or you can reach out to Shara and she can connect you either way. But we certainly welcome anyone who would like to. That's going to be a very important quarterly meeting of our legislative committee, as that's when we're going to need to decide what legislative proposals we will want to move forward as a region for the coming year, as those are going to be due sometime in May or early June at the latest. We don't have that timeline yet. So just wanted to let folks know about that. First big thing I think this group should celebrate is that a legislative proposal that we put forward to decriminalize fentanyl test strips to help prevent overdose deaths. Not only did it get moved on by the commissioner to the governor's office, but the governor's office did indeed include that bill as an administration bill, which means that House and Senate leadership have been assigned the governor's version of that bill, and will then possibly be handing it off to some other folks who are very anxious to carry this. There's been lots of support. This bill is House Bill 2177, and it essentially what it does is it edits the definition of testing equipment under the definitions for drug paraphernalia to exempt anything that's testing for synthetic opioids. So that covers fentanyl and these other analogs and things, and is very, very good news. So again, I believe this is the first, I'm not sure, I think it's the first bill that's ever formally developed through a Planning and Policy Council proposal, and Kurt can correct me later if I'm wrong, but I think we should be excited about that. So thank you to the department, to Kurt and his staff, and Zach Blair and Commissioner Williams and everybody else for helping to steward that along. And we'll need everybody's support, but we are working on figuring out what the plan and strategy is from here. So stay tuned. So great news. There's several other bills I'm going to mention very quickly that this group should be aware of. House Bill 2272 is a caption bill right now, but it's setting a framework for local overdose fatality review teams, such as the one that the Davidson County Health Department here is operating to look at randomly selected overdose deaths and figure out how we can get ahead of future deaths from a public health perspective, make policy recommendations, and so on. So again, this is a caption bill, and I'm actually working with with the legislative folks who are moving this to make sure they've got the best language possible for this. And waiting to get back.
Elliot,
Yes.
This is Robin. Could you please explain to people what a caption bill is?
Sure. A caption bill, that's a great question. A caption bill means they're not ready to file the full bill yet. So they want to get it in before the filing deadline this week, and they file it with a caption that points to the part of the law they're trying to change, and with some summary statement that's usually pretty brief, usually a paragraph or so, that gets at the general idea of what the bill is trying to look at. And then later an amendment will be filed that will call for deleting the original language of the bill and adding in the new text. So in this case, the legal department for the state legislature has not finished their work on the language that was provided to them, and they are working on getting that done. Does that answer your question? Is that sufficient? Any other questions there?
Do you mind if I say something really quick, Elliot?
Please.
This is Susan Mee, private attorney in Nashville. Several of you on this call know way more than I do about this, but I will just say that caption bills, while I don't think there's necessarily ill intent at all, can be really dangerous, because sometimes you'll see a caption bill kind of just broad language, and then later in the session, something really different will pop up. So in general, there's just something to keep an eye on. So anyway.
That's a very fair point. There was a bill last year that I was heavily involved in relating to mental health, and it was a surprise all of a sudden at the last minute. In this case, with this bill, there is zero ill intent. I can say for 100% for sure. This is just to get something on the book so they can. But you're right. If you see something that's got very broad language, it's just a caption. You definitely want to follow along if it's in part of the law that you're concerned with, because it could be just about anything. So definitely good to track that. And the Capitol website, the General Assembly website for Tennessee, is really fantastic. You can track bills directly there. It's a little clunky to add, but if you go to capitol.tn.gov, I believe that's the website, you can add just add any bills you want. You can create lists and so on, and you can kind of track that as you go. So thank you for mentioning that, Robin, and thanks for.
I just wanted to thank both you and Susan, because I know a lot of people are not familiar what that is and what could mean. So thank you for explaining that so well.
Sure, I forget that just a few years ago I probably didn't know what that was. So I get it, and anyone please interrupt if I'm saying something that makes no sense to you or you want to learn more. Also, a great opportunity to join our legislative committee if you want to learn more about this stuff. So pitch there. Okay, quickly, there's TDMHSAS has been working on a naloxone access bill that will make it easier for community providers and coalitions to help distribute naloxone to folks to help prevent overdose deaths. And this is a really positive bill as far as I've looked at it. I've consulted with TDMHSAS on this too through the Behavioral Health Foundation, and it looks really, really positive. That's House Bill 2158. It was still waiting on its companion bill. For those who don't know, every bill that's going to move has to have an exact copy of the bill in both the House and the Senate, and it runs separately through both chambers. Doesn't always have to be at the exact same time. So that one's working. There's also just filed House Bill 2228, a co-prescribing bill. What this requires is that when someone gets a prescription for non-narcotic opioids that exceeds a certain morphine milligram equivalent, like a high amount of narcotic opioid medication, there's other risk factors for overdose, that this is suggesting that doctors and prescribers recommend and offer a prescription for naloxone to the people they're serving. And this is part of what's already in regulations. It's just kind of codifying that. That's going to have a tough path moving forward, but it's still an interesting bill to look at. Another bill, House Bill 2335, it's a caption bill right now, but it is aimed at increasing the number of patients that nurse practitioners and physician assistants can treat with buprenorphine prescriptions in office-based opioid use disorder treatment programs, OBOTs, as they're known in the licensure world. It's also looking at addressing out-of-state telehealth only buprenorphine treatment and how those groups are regulated. So that'll be interesting to follow. House Bill 2348, it allows ambulance services to get reimbursed for out-of-county mental health transports. So this relates to the work the sheriffs are doing and some grant programs that exist already to help reform emergency mental health transportation and try to get healthcare transports instead of law enforcement transports whenever possible. So that'll be interesting. There is a bill that was filed by Senator Reeves, and I forgot who was on the House side, but House Bill 2218, which studies the needs of patients with serious mental health issues at emergency departments. House Bill 2297 would increase the ratio of students to school social workers to the nationally recommended standard of 1 to 250. We should probably support, it would be great for anybody interested to support the folks in our fellows in the disability advocacy community. They're really excited about hoping to move House Bill 905, the adult changing table bill, forward to help adults with physical disabilities and who need those issues and intellectual disabilities. Let's see, there is another one which I'm not sure if I'm concerned of it or not, but House Bill 2250, it would allow nurse practitioners and PAs to sign the second certificate of need for involuntary commitment. Right now, that is reserved for doctors. So I know the Medical Association is likely to push back on that, but will be interesting to follow. And those are all the bills that are really, I think, should be on a radar. Oh, also House Bill 677 is being brought back. This is about step therapy. This is that fail first. So think about when someone's asked to try a certain medication for a number of weeks or, doses until they're allowed to try the next or certain level of care. This is to create some better regulations to make it less difficult on patients who are dealing with, some of these insurance requirements for step therapy. And there's been a group working on this outside the behavioral health community for some time. So if anybody's interested in learning more about any of these, getting more context, please reach out to me. There's no possible way to do that. But then I have to also say the budget was just reported, and I know Kurt can fill in any gaps. I'll say I'm really excited about what the department proposed. And I know the department has done everything possible to get the kind of funding that we need to move things forward in this state. I'm personally a little bit disappointed with a few things that were omitted by the governor in his budget, but there is a lot of good news. So while Commissioner Williams proposed $107 million in new funding for the department, the final total that was included in the governor's budget for the department was $28.2 million in new funding. That sounds worse than it is. But assuming that the department can get some other things they've asked for from the Financial Stimulus Accountability Group, which is looking at unspent American Rescue Plan Act funds, and has proposed $35 million for 3 CSUs and walk-in centers in Montgomery, Obion, and Maury counties. Which would be great. That would actually be a little bit more money than was requested in the original budget proposal, because those did not make it. And that also asked for that group is $6 million to expand Project Rural Recovery. These are mobile clinics that can move around in rural areas. That wouldn't really help us here in Davidson County, but I wanted folks to know about that. So certainly would hope that the department can get those funds. And from what I read, the department should know about that by March. And there'll be some opportunities potentially for public comment on the opportunities in February when that group meets again. The cost of living adjustments, these are raises for mental health and substance use treatment staff. The governor reduced that line item in the department's budget from $36 million to $18 million, but $18 million is certainly still a very positive number that gets at 10 of 20 years in back pay that we're trying to account for here. So we're still 10 years behind based on that number. The substance use treatment, $6 million was kept for that. Another $1 million for addiction recovery was kept. Those CSUs and walk-in centers I mentioned, those were omitted in the governor's budget. $26.5 million for substance use disorder residential treatment infrastructure was omitted in the governor's budget. That's not to be replaced anywhere as far as I see. There was a new item added, the Tennessee Sports Gambling Fund for $1.2 million. I personally think that's great. I don't know where it came from, but I think it's good to have more money to address these issues. The one thing that I'm most disappointed in, just given all the work I know the department and a lot of folks in our council have done on workforce issues over the last year or two especially, there was a $10 million pot of money for a various set of workforce-related programs with recurring funding. This would just set up internships and stipend or incentives for folks to join the field and so on, and an internship portal. That money was not included in the governor's budget. So we are still at square one when it comes to actually doing pipeline-related workforce initiatives funded by our state government for the behavioral health workforce. The TennCare does have some funding, very limited funding for the behavioral health workforce, mental health specifically, but there is no workforce infrastructure program related to behavioral health. The Creating Jobs Initiative stuff funding stayed, which is great because that will draw down some federal funds on top. That's just shy of $1 million. $500,000 for IT support service the department desperately needs. And then a new line item was added for a Morgan County recovery court, residential recovery court. That was $500,000. So that was a lot. I hope that's helpful, but that's what we're seeing right now. And I'm sure, again, I'd ask Kurt, please fill in anything that I missed when it's, if you have a second and I don't know something that you do.
Hey, Elliot. No, I think you hit all the highlights. I'll just go back and reiterate a couple of things you said. One, yes, the crisis continuum expansion, the 3 CSUs, adult CSUs that we proposed in our budget request. It's not in this proposed budget, but we're hopeful that it will be addressed in the federal COVID funding, the ARP funding that's out there. The gambling money, that is the result of, so a couple years ago, as y'all probably could not avoid the last few weekends, y'all know that Tennessee has legalized, sports gambling. That was a couple of years ago. The department gets a small percentage of that money, of that revenue. And so I believe that money, Elliot, that is in our budget this year is just allocating the funds that have been accumulated over the last year or so. And then you're right. I think that the workforce development initiative, the $10 million recurring, that's something that was not included. And we have that report that's on our website. I think it's still a good resource and tool for advocates for this issue. But I would also say that I think the cost of living was something that could possibly be seen as an ability to impact the workforce to maybe retain individuals, keep their pay competitive, or make their pay more competitive with other industries and professions. But yeah, you did a great job. You're tracking a lot of just like we are, very interesting bills, and it's just starting, and can't wait to see how the 2022 legislative session turns out. We've got a lot to be excited about, and we need your help and y'all's insights to make sure that it's a successful one for us. So thank you. Thank you, Elliot.
Yeah, thanks, Kurt. And actually, I have a real quick question. I don't mean to put you on the spot, but I was trying to figure this out myself. I know that TennCare originally had $7 million in their budget proposal for mental health workforce cost of living adjustments, raises. And when they reported in the budget, they have a combined line item with dental cost of living adjustments. Do you know how much of, I'm guessing off the top of my head, it was like 28 total million or something like that. Do you know how much of that was specific to mental health versus dental?
I don't, Elliot, but let me get with Mary over at TennCare, and we can get an answer back for you.
Sounds great. Sorry, again, didn't mean to put you on the spot. It was just a big question.
No, it's a good question.
Elliot or Kurt, can either one of you answer, where's the status on the peer centers? Are they included this year?
I'll defer to Kurt. I didn't see them as omitted, but I want to make sure.
Yeah, that was one of our proposed, every department was asked to make a proposed cut. And that's usually just an exercise, especially in times or economic times, I guess, for revenue for the state are as good as they have been. But no, that cut was not taken.
Good. Thank you.
Very, very positive. I was, yes, very happy that stayed. And of course, I know that those folks in our peer workforce are, I know we have to pick something, but they're certainly a bit tired of seeing themselves on what they call the chopping block every year. So I know that whether it's an exercise or not, hopefully we can try to find some other way to look at how we can do those in the future. Just thinking out loud, but I appreciate that. And I know the department certainly did not want to cut that funding. So thanks again. Any other questions?
Yeah. I'll just say that, yeah, it's tough. I know that that's not something that people are excited to hear. I think the philosophy that we have used over the past year or the years when this has been the presentation we've made is, direct services versus support services. And that's been I'll quote Governor Haslam, going back a governor, a lot of the times you're making decisions between great ideas and good ideas. And luckily it has been an exercise over the last several years. And we're lucky that we didn't have to make that decrease this year. But thank you.
Elliot, this is Evelyn. With the workforce initiative looking at employees or schools or whatever, is that something we can go back and look at again?
Certainly. I think we proposed a legislative proposal from our region. I know the commissioner wanted to certainly see this play out with a group that was being put together, which our region helped influence by putting in the needs assessment, and that we thought workforce was a big issue. But I was very much a proponent for keeping this as an ongoing process. I still am. I'm going to remain vocal. I hope others will. But I mean, we need to be looking at this every year until we can really get to where folks are not having to fill in as techs at their facilities, because they don't. These are executives filling in frontline staff roles because they don't have anybody else to do the work.
Exactly.
I'm hearing this primarily on the addiction treatment side, but I know in our mental health delivery side, I mean, it's bad. It's really tough on folks, and people are seeing that these are stressful occupations, and I can make more money somewhere else, and so I can get better hours too, and they go do it. So we've got to come up with some solution for pipeline, and we know that we're competing on the physical healthcare space with these kind of workforce initiative programs, but they've existed for a very long time on the physical healthcare side, and it's long overdue that we address it on this side. So again, commending the department for taking this very seriously and moving it forward. I know that they proposed some great ideas. And I think we need to support them by continuing to raise our voices and continue to see how we can do this. I think if nothing moves, there's been some discussions among several advocates about legislation for next session.
Okay, thank you.
That's my full report. So unless there's other questions, I'll defer back, Shara.
All right. Thank you both, Elliot and Kurt. I know there was a lot of information. Great updates on what is going on with these bills, and I mean, there's so many important things happening right now. So we will now move into the reason why you came today, our needs assessment discussion. We are hoping to get a good bit accomplished during this meeting. We do, as Kirby told us earlier, our worksheets are due to the department no later than the 1st of April. So there's definitely going to be work done beyond just this meeting. But you guys know, I feel like it's very important for everyone's voice to be heard. And I just value you guys' participation so much. So we can get started. I'm not even sure where to start. So Robin and Angie and Elliot and Evelyn and those who have gone through this process before, what's the best way to get this? Yeah.
Hey, sorry, I didn't mean to interrupt you. Do you want me to go ahead and just before we get started, do you want me to go ahead and put up the needs assessments that were submitted last year on the screen so everybody can take a look at them?
Yes, that'd be helpful.
And just a reminder, obviously, before you get your discussion started, just a reminder that we talked about in the November meeting, we have the option to submit, or you have the option to submit anywhere from 2 to 6 needs this go around, just as long as it's equal representation of substance use and mental health. Okay. Let me get this. I have it on my desktop, but if you saw my desktop, it's one giant puzzle these days. So hold on one second and I'll get it up here for you.
All right. And we do have from the adult committee, we do have the results of our survey. I sent that out to the adult committee for you guys to have on hand, and then I have a printed version of it. I can share it with everybody. I just didn't want to jump too far ahead of the game while we were discussing other agenda items.
Let me know if you need me to enlarge the print on this.
Yeah, I think if you can just a little bit.
Is that better?
Yes, ma'am.
Okay, great.
All right, so Kirby, I think the So one question, and I know this has been answered. I've asked it, I'm sure, but for some reason my brain is having trouble wrapping around it. When it comes to our priorities,
No, I just needed that.
and we're coming up with like the total that we're gonna submit. Priorities related to adults and priorities related to youth they're all combined together, right? We're choosing from these. Right now we have kind of two working lists.
So every regional council,
them all.
Can you hear me?
Yeah.
Okay, so every regional council does this process differently. They all have their own mode. So there's no requirement as far as it goes, as far as it pertains to children and adults' needs. It's really whatever your council decides on is identified in your region. So now there are some regional councils where they have, you know, 2 children's needs and 2 adult needs, which obviously is going to look a little bit different if they decide to submit 3 of each this go around. But they usually have their adult committees work on a needs assessment and children's committees work on the needs assessment, kind of like it's an ongoing year-round process, and then just bring what is identified to this meeting. Since every regional council only meets one time in Q1 before the needs assessments are due. So really these meetings are bringing whatever the adult committee and children's committees have discussed, reviewing the needs from last year to see if they're still relevant this go around, and then having an open discussion if maybe wording needs to be changed for the need, or if you want to remove a need entirely and add another one. And oftentimes regional councils will need to meet again later, just kind of to finalize everything and vote on things. I know a couple years ago, was it about 2 years ago, Robin, that you sent out like a survey? You had the list of needs that were discussed, and then individuals were able to vote in a survey type format. So it's really whatever works for you all now. But now what I would suggest, just to make it flow, is to go through each need that was submitted last year, kind of have a discussion on if that's a need that needs to stay, and then maybe reach out to the adult committee and children's committees on what they've come up with, and then go from there.
Okay, so we have both of those committees did the survey, and so we each have our top 3. So we've already looked at, I know on the adult side, I believe the children's committee did this too, looked at last year's needs and priorities, and then kind of worked through those, and they came up with a list that then was put into the survey that we all voted on. So I guess where the point we're at now is bringing the top 3. Well, we did for adult, we did top 3 on mental health, and then top 3 on substance use side. So top 6 from each committee and discussing those. Does that sound?
And Cheryl, what I might recommend to you is you can keep those. You can look at what was ranked and what people had put in there, and then whatever's not, you can let the adult committee and children's committee decide what they want to submit. And then there are several other needs that were recommended, and then decide which ones of either leftover that you want to prioritize for the whole committee. So you could do it that way. You've got your ranked issues, and I wouldn't start all over again because that would be very time consuming. But people have been given an opportunity for input. And so I would take with the ranked input that you have and let people decide on it.
Only thing, if it's okay to interject, I just want to say, I'm not sure it was clear even to me until recently that the needs assessment process was going to be done exclusive or mostly in committees. And so I'm not sure that other members would know that. I feel like how we've done it before is the committees recommend things to the full council, but the full council makes the decision. So I don't know. I guess I'm a little uncomfortable with letting unless it's very clear and everybody agrees ahead of time for the committees to decide on specific needs without the full council's input. Just wanted to throw that out there.
And I think, Elliot, what we were doing is we gave opportunity in November, and I think we sent information out to everybody. And then the committees did, the two committees did meet. And then what I'm suggesting is you then take, you know, what's there, and everybody's always given an opportunity to participate, guys. I know it's not the first thing people jump at, and there are those, and Elliot's great, and other people are great at sharing and bringing things to our attention, and I appreciate their participation. And the rest of you have need to make sure that you're also, if these are important to you, that you are participating. I know time is limited. I get it. We all do. But yeah, so that's just my comment on it, and I appreciate what Elliot's saying.
Hi, I just want to add this. Everybody's suggestions and input is really, really good. However, I would just keep this in mind as you present the committee suggestions or rankings that was provided in the surveys, sharing that with the entire council as a whole as you go through that, and then get council input on those. And then if there is any type of discussion that needs to take place regarding those suggested needs, then that takes place in this meeting. And then from there, the council as a whole decides if that need is going to be put forward as the prioritized needs for the entire council, is what I would suggest that the process be. But the hard work, as Robin says, and Shara says, and Evelyn, I'm sorry, has put, and I think there was someone else, the main work from the committees have been done. And we always like those committees to meet, to discuss, and everybody has an opportunity. Now it's time for the work that has been done by that committee to be brought forth to the full council.
Is it going to mess anything up if I attempt to share my screen while Kirby is also sharing her screen?
Don't think you're going to be
I'll
able
just
to.
close mine. It's fine. I'll just close mine.
I don't want anything to blow up.
So, no. Hold on. I'll stop mine. It's fine.
Okay. And I'm gonna pull up so this is from the adult committee survey. Let's see.
As you're doing that real quick, Kirby or Avis, is the form for the needs assessment, the worksheet, identical other than the year this year? Can we just change that, or do we need to put everything onto a new sheet if we're repeating a need?
Yeah, I shared it. Was it not shared with you all?
I believe Kirby sent that out in the original email she sent out. Correct me if I'm wrong, Kirby, back in November. December. Yeah.
I could forward it out. I could share it out again. It's basically the same format. It just looks a little different now that we can include 6 needs.
Correct.
But I could share it again, Elliot.
Okay, so can we have to translate it to the new form versus recycling the old, just to be clear?
Just make sure, really, the top priority, obviously make sure the year is changed and the ranking.
Oh, I see. So instead of need X of 2, just of 3 if we're doing 3.
Just make sure 2 of 3, 1 of 3, whichever.
Perfect. That could just save time if, let's say, we're putting.
Yeah, nothing's changed in the body of it.
Wonderful. Right. Thank you.
Yeah. Great point.
All right. Can you guys see my screen?
Not yet, Sean.
I can't.
Okay, so when we look at from the adult committee, when we look at the top 3, so blue is 1, the peach is 2, and yellow is 3. So
everybody don't see the screen.
We can't see it, Shara.
Oh, sorry.
It's okay.
clearly can't. I clearly cannot hear because I thought it. Okay, screen. Control. Okay, what do you guys see now?
Your initials.
I'm about
Maria's
to give
giving
up.
you a
You'll have to,
message.
I think you have to hit share again, and then you click on the document that you have. It's easier, I think, if you have it opened up on your taskbar.
Yeah. Okay, it's open.
Or you could send the document to
Still nothing,
Kirby.
huh?
Yeah, if you want to
She
just
can
email it to
display
me
it.
really quick, I'll share it.
Yeah, it is showing on mine like it was sharing, but clearly it wasn't. So
Yeah, just send it
I'll
to
get
me.
this
I'll share it. It's no
over.
problem.
Okay. And then, so while we're finagling with this one, Susan, I know you presented during the children's update on you guys' needs too, but do you want to, if you don't mind going ahead and reminding us what the top needs were for y'all? And then
Okay, give me a minute to pull that back up and I'll do that.
Start.
The number one was increased after school childcare for children with disabilities and working parents for several hours.
Was that after school childcare?
After school childcare for children with disabilities.
So in this context, we're specifically for children with mental health issues. Is that what we're looking at? So, because this is obviously for the Department of Mental Health. I just want to make sure I know the focus here.
I will ask Maria to chime in on this, or Robin.
I think Linda is on the call. Linda, you guys get a lot of calls you stated during the meeting around after care, and I'll let you take it from there.
Yeah. Let's see. Can you hear me okay? Okay. So yeah, so a lot of parents, they will call in looking for after school care, and it could be all types of disabilities. I think the number one disability is autism. But it could be all types of disabilities. It could be physical, it could be behavior. But like I said, the number one is autism.
Thank you for explaining. If that is your target, I'm trying to be helpful, as I don't think that this process through this department is going to help address that need, but there is the Developmental Disabilities Council. I know the great folks that work there and do the policy work there. Be happy to help you with them.
I'm on that council.
Okay, and I think, of course, you've got the Tennessee Disability Coalition and others. But I think what we're at, and someone can correct me if I'm wrong, but based on my understanding, having led this process before, is that we have to stick to the limitations of what, I think we should stick to what we can realistically ask the Department of Mental Health to include in their planning. And if it is something related to developmental or intellectual disabilities specifically, it's going to fall outside of their domain.
And I think Elliott's correct. If we don't center it around children with mental health needs, it kind of falls off the table. If it's involving intellectual disability or autism, it maybe needs to go to another circle.
Okay, the second one was create respite opportunities for parents of children with behavioral health issues. And the third one was increase the number of psychiatrists to work with children and youth who will take commercial insurance, TennCare, and non-insurance. So those were the top three.
So the second one sounds like it could sort of get at the original, issue that Linda is suggesting. Again, respite care can be helpful. It may not be specifically after school, but maybe that's an option. So if that's what the committee feels, that sounds reasonable. I maybe personally I have a little bit of concern with limiting that last one to just psychiatrists. I personally think that based on research, we're way overprescribing medications to children, especially earlier on in their treatment, and that should not be something we always look to as the first solution. And so I would much rather that be more general to behavioral health professionals or mental health professionals if the committee would be amenable.
What do you think, committee?
If you're asking me, I think there are shortages all around, and I would agree with that issue. That's not a problem, but we've always had a shortage of psychiatrists. That's not a new thing or a new issue. That as long as I've been working in this field, that's always been an issue. But yeah, I think if we broaden it, it would be easier because the workforce has its challenges right now.
Yes, I mean, we're also asking for, when we're trying to get bills passed that drop the school social worker ratio, I mean, if we have a limited pool of folks to pull from, and now we've lost our pipeline issues. So I'm hopeful we can agree as a region. At the end, I'll be quiet, but on maybe we just suggest the exact thing the department just tried to ask for with that $10 million pot of money for workforce initiatives. We know that the commissioner supports that. Maybe we can include that as a need to help support what they're trying to do. Just throwing that out.
And I agree with that as well.
I would like to comment with dealing with psychiatry for children. Not all doctors prescribe medications to the youth, to the children. So they go in, they get assessed, and you take it one step at a time. So I want to take that stigma away.
I appreciate that, Stacy, and I'll just say that the way our current system, our care system, as I've been in it, and I'm sure there are exceptions, but generally the way kids and anyone is entered into care is their first assessment is not with a psychiatrist unless they do pay out of pocket and choose to do so. It is with a therapist, a master's level therapist, and then they are referred on to a psychiatrist who, in most of the mental health system, their role is specifically med management oriented for the most part. Now, again, they may sometimes not do that, but if someone is seeing a psychiatrist, that 99% of the time means they're getting medication.
I'm with you now.
Shara, did we lose you?
Shara she just emailed me. She's having connectivity issues with it.
Okay.
I did get her document though. She was able to email that to me. Do you want me all to pull that up? So you could at least take a look at it.
Sure.
Just for
should we hear the needs on the substance use side of the Children's Committee, if there are any?
Also, if Shara's having connectivity issues until she can get back connected or call back in, if Angie is on the line who could step in maybe temporarily to continue to chair the meeting until she returns. Angie, are you still on the line?
Hey guys, I'm back on. Can you hear me?
Okay, great. Yes, we can
I'm
hear
so
you.
sorry. So
No
I'm on my
problem.
phone. Hopefully this won't, it's something with my laptop. I couldn't even get the email to send. So I am so sorry and I have no idea what I've missed. I just trust that it was great progress. And so
I think we were going to ask, Elliot asked about substance abuse issues on the children's side, if there are any, before we move to your spreadsheet that you sent me.
Okay, perfect.
And I think it's important to note, guys, that you've got to have an equal amount of both. So the Children's Committee had not yet identified, as far as I was concerned, they hadn't narrowed down or assigned whether something was substance abuse or mental health. So we need to look at those needs to make sure that you've got an equal amount of both.
You're correct, Robin. Thank you so much.
Okay, good point, Robin. Also, there's a chat, there's a comment in the chat box from Tristan Petty. And Tristan, is this related to mental health before we move on to substance abuse? Could there be something that addresses greater access to therapeutic services? Does anybody have or Tristan, do you want to unmic and talk about that a little more?
The only reason I said that was like when talking about increasing psychiatrists, to word it differently, I was thinking maybe just an idea throw out there about how to increase availability or access to therapeutic services. Because I can tell you from where I sit, you're going to have a hard time increasing psychiatry access because there's a lot of providers who are not taking insurance anymore, are strictly going cash pay. I won't get into that. I'll spare you all. But I do think that there is a significant barrier. I know what some of those barriers are, but certainly not all of them. But I totally lost my train of thought. It was just a thought I threw out there to kind of get my mind was stirring up ideas on how to maybe word that or be a little bit kind of like going to what I think it was Kurt said about looking at things in terms of a direct service versus support services. I don't know. I just threw the idea out there. Sorry.
No, thank you.
Thank you, Tristan.
So I have to agree. I kind of like where Elliot's coming from. The issues that we've got here really to some degree are probably workforce related. Or probably even to a greater degree are probably workforce related when it comes to, and we can include, we don't have to narrow it to psychiatrists, but we can include that. And I think that's what both Tristan and Elliot were trying to say, is to get that a little wider. And that will help. That will help give our parents and their kids more access. But I do think, again, we know, like Maria was saying, we know the shortage has been there for a while. So let's take a look at that. How could we reword that to be inclusive of, and Elliot, maybe we do want something that is just workforce named, and then another issue that is, therapeutically oriented. And then if we go ahead.
I was just going to say, last year we did the our workforce needs proposal on the our worksheet on the substance use side. Maybe this year, if there's room, we can do it on the mental health side and specifically mention some of these folks that we're talking about, access to therapists and therapeutic care, psychiatry, et cetera. But I do think all that is encompassed in what the department is trying to do with their $10 million plan. I mean, I really like the idea of rubber stamping what they've suggested. That came out of an effort where Planning and Policy Council leaders had a say. It was, some of their work was based on, well, selfishly, a paper that I helped write a while ago. I mean, it's good stuff that they put in that report, and I think we can be helpful to the department. Just me speaking, in terms of putting that forward.
So Elliot, I think that might be as important an issue, and the fact that it got shot down, to bring up to rise to the full council rather than just keep it in the children's committee. I would suggest that we rise that up to the full council needs assessment rather than keep it into the children's committee.
Robin, I agree. And I think there has been some confusion in our recent meetings about this, and maybe hopefully the department can clarify. But if I understood what Kirby and Avis were suggesting, the only needs that we're submitting as Region 4 officially are the ones that the full council approves. But if I'm wrong and our children's and adult committees do their own and submit those, it would be good to get clarification at this time.
Mm-hmm.
Yeah,
I think you're, oops, sorry.
No, it's okay. The full council has to vote on the needs.
Yeah.
So
yeah,
just throwing it out there
was to have, the focus on the different the two age populations, and then bring it for the full council to then look at, so that we weren't starting from scratch with everybody that's on the council. And I do also like the idea of moving with the workforce, going along with Tristan's suggestion, and how, like, to me, it does sound like it's, and when I look at what the issue is and kind of the challenges, definitely a workforce related issue. So, moving that over, and it could apply for providers that serve children and adults, right?
Mm-hmm.
Can I ask for clarification from the department, because our children's committee, the needs that they put forth are then put forth to the state children's committee, correct? And the same with the adult committee, in addition to being voted on by the regional council. Isn't that correct?
So do you want me to talk on it, Avis, or do you want to answer?
So I'll answer. So Robin, what you said is pretty much true in the sense that if there is a representative on statewide council from the Region 4, they will share that information at the Adult and Children's Committee meeting, okay? But as far as the work of the council itself, the Region 4 council, those two subcommittees can meet separately, identify needs, bring that back to the full Region 4 council for discussion, as we're doing today. And then once that discussion is held, then there is a vote on the final prioritized needs, whether it's 2, 3, 4, 5, or 6, to submit to us, to the department, as your final needs. So does that make sense? And did I clarify for you?
So we just want to make sure, because what we were understanding in the subcommittees, we thought we were identifying for those committees in particular, and then let anything else rise up, just as I'm recommending, out of those committees. So you're saying up to 6, and within those six, you would also have children's and adult recommendations. Is that what you're saying?
If that is the pleasure of the full council, yes. The recommendations from your committee, as you're doing now, are being heard and discussed. If the full council, Region 4 full council, wants to have, children and adult needs within that parameter of 6 as the max, yes, you can do that if the full council decides on it.
Okay. Okay. I think that's really helpful, because I don't think that's been entirely clear previously, because we've always been asked to do children's and adults, and where are your children's and adults So that is helpful to understand that.
So the other piece of this, the reason why, and as Kirby stated before, we increased it to 6 because we had some regions to say to us or ask us or comment to say, sometimes we feel like we can't get a children's need in there as well as an adult. We always submitting the adults. This extra 2 that we have added to get the 6, now we'll give you that opportunity if you would choose to do so, if the full council chooses to do so.
Okay.
Did that clear things up?
That helps. I just knew that previously we, and it had been impressed upon us, where are your children's needs and where are your adults? So we really worked on that this year.
No,
and that's perfect. That's what you're supposed to do. We have many regions that have both the children and the adult committee, and those committee bring those needs that they have identified in that committee to the full council for discussion, and they vote on it, whether it's in that meeting or an email vote, and then it's submitted to us.
Okay.
And Robin, it is important for the statewide Children's and Adult Committee, and I believe there are representatives from Region 4 on both. So they do bring the needs that were discussed in their subcommittee meetings to the chair and vice chair of the statewide committees, and then they have their own separate vote on what they're submitting from their committee. So they are taken into consideration. I don't want you to feel like you're just doing it just to do it, because that's not the case.
The work is not in vain.
I'm just so proud of the fact that we've got some people, Susan and Maria are really trying to work hard to get this built. And then we identified some folks and, to get this rebuilt. And so I've been more an advisement than anything. So I want to make sure I was, on the right track with it.
You're absolutely on the right track. And we definitely want to hear what those committees say and applaud the work of those committees. And that work is shared with the statewide councils as well as your local regional council. So never work in vain. It's a good starting jumping off point, I'll say, because you've done a lot of the work. So just keep that in mind as you move forward.
Okay. So I see that Angie is not here. I know this is new to Shara. Elliot and I are the ones that have probably the most experience with this. As he said, as both former Region 4 leaders. So in the interest of time, what I'd like to suggest is we can and Elliot and I both know from experience that we're not going to get this resolved today. But what we're probably both, I know what I'm trying to avoid, because I simply don't have the time for it, is in the past, what has happened is the committee just leaves this to 3 or 4 people who end up doing, the legwork on this. And those 3 or 4 people that you've had in the past, and I'll speak for myself, don't have the time to give to this degree. So we need buy-in from those of you that are quietly sitting in your chairs and may not understand this, and that's okay. We can support you and help you with this, but we can't take on, I know I can't take on full load to get something done. And so that's why I've agreed to be in advisement capacity. But we do need a process to bring this forward, the needs forward to the full council. And so maybe what we could do is gather. We have some things that have already been laid out. There might be more things that you guys have, and some of you are in positions to know things more. Elliot's certainly got legislative experience and a lot of information that gets channeled through his Behavioral Health Foundation. Others of you are very active in what you are doing and in specialized areas. So if we could. And is Rusty here today? I don't know that Rusty's here today. Is he here?
Yep, I'm here.
Yay, Rusty. You've always been great about getting everything down. So if people could bring forth what their recommendations are so that we could maybe spend the rest of our time, getting those down, and then at the end leave time to really divvy this up so that we can get the work done.
I appreciate that. Just wanted to summarize. It sounds like we may have two if the group likes them. We have one. I mean, I certainly support the need for child respite care. I know that funding has come and gone over the years, and certainly folks need breaks. So I think we can maybe pair that with some after school issues to make sure we hit two with one. And then the workforce issue on the mental health side, and well, on both sides, but sounds like we've got two as of right now that we can look at. So I would, maybe we should look now at, I think Shara said, or Kirby's got Shara's document. We can look what the adult committee came up with.
Yeah, I was going to say the same thing, Elliot. I think, excuse me, if we can, because we do have quite a number. You know, we have 6 that have been highlighted, but there are a number that I want to be sure people have a chance to look at that maybe did not receive as many votes, so that we can open it for discussion and just kind of to catch up from where I did get kicked off. So, so the discussion around like respite slash aftercare, childcare kind of options for children with mental illness is one that we do want to kind of elevate up on the list that we're talking about on our priorities.
Yeah, I think that was a general consensus, and you may want to have everybody, just raise a hand or vote or something on that, or put something in the chat. I don't know.
Could we maybe wait to see what all of them look like before we vote on any officially? I think that way we'll know what to include. I'm sorry, I just don't feel comfortable yet.
Oh, Elliot, I'm not saying a full vote. I'm just saying the two things that you just mentioned that rise to the top, just put them aside so we know that those are important. I don't mean vote. No, perfect. Absolutely. Yeah.
Yeah, I agree with that, just to kind of help.
Yeah, no, not a formal vote. No, not at all. Mm-mm.
How do we interpret this sheet, Shara? What does this sheet mean? How do we know how to make sense of all the numbers?
Okay, so this is the report from the survey sent out to the adult committee. So across the top, you have the priority that was identified. The numbers, so I tried to hide as many cells or as many rows as I could before sending it. But at the bottom, there is a total, which is highlighted as well. Kirby, there you go. So the numbers in between are the actual individual votes. So you have the total number of votes at the bottom corresponding with the priority at the top. Blue is the one that had the most priorities. Peach is the one that had the second most, votes, not priorities. Peach is the second most votes, and yellow is the third. And we have 3 for the substance abuse side, 3 for the mental health side.
So Kirby, I think it'd be important, I'm not Kirby, Shara. So this was done with a lighter scale, 1 to 5. For each one of these, is this a number 1 for you, or is this down 2, 3, 4, 5? 1 being the most important, 5 being the least. So the more votes you got was the least priority, and the fewest votes you got was the top, because the lower the number, the higher that people placed it as a priority. So people just put for each thing, what they did they rank it as the highest, number 1, or the lowest, number 5? And then the total at the bottom was, by looking at that total, the lower the number is actually the higher the priority. Does that help? If that helps make sense for people.
So as you can see,
this is Angie. I have a question.
Yep.
So if we were to look at these with the number of number 1 votes that were in each column rather than the total number.
Yeah.
Just a real quick thing that I went through. It looked like under the yellow increased case management, there were 11 of those that got a number 1 vote. In expand evidence, there were 6 that got a number 1 vote. And then in the peach column, 1, 2, 3, 4, 5, 6, 7, 8, there were 8 that got a number 1 vote. I guess I'm just 1, 2, 3, 4, 5, 6, 7. There were 8 in the increased harm. I guess my question is it the appropriate way to do it is to add the total number of votes, or is it to look at how many people voted number 1 in each of those columns?
I think I can help. I took this survey and it was a little different for me, I'll be honest, but it was, you had for every issue, it just listed each issue and then you could select between 1 and 5 how important that issue was to you with, and I can't remember off the top of my head, but I think 1, typically I think more being higher, but I had to get my brain around 1, meaning it was the very important, 5 meaning not very important. So that's what these numbers are. So they took, the scores have basically, you're just adding up the total priority across everyone. It doesn't account for how many, there's
Right.
no like first ranking votes. Does that make sense?
Yeah.
It was a makeshift Likert scale, I guess.
So I guess my concern is at this point, if I look at the number 1s in the peach column, there's 8 number 1s there. There's 8 number 2s in the increased harm reduction column. There's 11 number 1s in increased case management. There's 6 number 1s in the expand evidence, and there's 3 number 1s in create opportunities. So right now we have the expand evidence, the increase case management, and expand and improve data access. That's by adding up all the numbers. If you add up just the numbers of 1, so people that said that was their highest priority, then it turns into 8 for the first column, 8 for the second column, 11 for the third, 6 and 3. So if we did it but that way, we would actually take the first 3 columns would be where people place the greatest priority. Does that make sense to people, or have I just totally misinterpreted this?
I think you're misinterpreting a little. These were not priority rankings of the actual issues. For each issue, I mean, there's far more than 5 issues, and you just had to say, but 1 meant you thought it was very important. 5 meant you thought it was not very important, and then there were some clarifying things in the middle. So it's not a ranking. It is a specific, do I like or do I not, or do I think this issue is important or not? So it's not quite as you're saying. I think the way Cher presented it is technically accurate, but we could also look at that as a secondary way to analyze the data.
And it was just meant to be something simplified, honestly, that people could respond to.
Cher, could you maybe, or as someone from the adult committee, like what are your recommendations to the council?
This is Evelyn looking at it, and I, like the others, was looking at the way they rated number 1 as maybe that was their priority and what they wanted to look at presenting. But and I had, this is the first time I've seen it. I didn't see it in my email previously, and it may be there. But that's how I was thinking when they rated number 1, that was a high priority and what they wanted to present, and going all the way down to 5 is what they right now would be least likely what they want us to present. I don't know if somebody else read it a little differently.
Well, Elliot, to kind of answer your question, the idea was to have this to present to the full council as to show, you know, out of all of the priorities that had been listed, which many are kind of carryover from last year, here is what rose to the top among the adult committee. Of course, now I'm re-looking at the numbers differently with all the conversation, but that was the intention. And so
what issues do you see as rising to the, like, what issues does the adult committee want to, what are the, I guess, needs on both sides the adult committee wants to put forward to this group? I think we kind of have to move on, unfortunately.
So going based off of the survey results, as they are, we would look at expand and improve data. So on substance abuse side, expand and improve data, access and coordination, increased case management, wraparound services, and peer supports, expand evidence-based treatment options, those three. Then from the mental health side, same-day access to established outpatient intake, therapy, and med management. Excuse me. Expanding mental health recovery housing with support and additional funding, and then increase case management / wraparound services and supports. So on the mental health side, the one highlighted in yellow is the one that pertains to the workforce. So I feel like that's already been discussed. I mean, and so we can just, I don't know, it's already been discussed. So we can kind of take that out of the conversation for right now, since it's already kind of on our list, and then look at the remaining 5.
It sounds like recovery housing is a need. I know we've talked about that for older adult populations in the past, and specifically, but is it if it's okay if I'm trying to help just lead, does the committee recommend that one as one for our group to focus on? And should we focus on a particular population or broadly? And is it mental health, substance use, or both?
So the housing that we have most talked about has been for mental health. I mean, I don't know if it's appropriate for me to do this, but I would like to recommend looking at that as a priority. And I guess, so here's where I have a question too for Avis and Kirby and Elliot and those who have way more idea of how this works. I know on the statewide committee, this has also been a hot topic. And so how do how does the council determine if it's something that we want to recommend and include in our needs assessment versus one that it needs to be more on the statewide level, not just the regional level?
Go ahead, Avis, if you want to respond to that.
I was just going to say, keep in mind that even if the region has decided or are suggesting or coming up with a need, even if you come up with a need for the region, doesn't necessarily mean that it's not going to show up on the statewide committee group as well. Okay. Because number one, you have more than just the representation of the regions on the statewide group, both the children and the adults. So it could be that other folks make a similar or identical suggestion for that same need. So just don't think of it. I guess I'm trying to get you to understand. Don't think of it as, if it shows up on the statewide, that's fine. But if whatever the region wants to put forth as a suggestion and the majority selects that as something to move forward with, kind of keep in mind that as you all are moving forward with your discussion.
Okay, thank you. So it's not like an either or.
It's not like an either or. And Robin, don't want to exclude you. Did you have a comment?
Oh, I was just going to say that I'm in favor of what Shara was saying as far as putting the housing on the mental health side, because I feel that monies are coming in to support, not that there's not need, but there's more money coming in to specifically support the recovery side. And if I'm misinterpreting that wrong and you're from that recovery side and you see it otherwise, please do share. But and I think we have noted specific needs for the geriatric and complex medical population for group homes, and I know duly diagnosed was in there, but I would say housing for specifically medically fragile and seniors. It's been something that we've identified for a couple of years now.
And this is Susan, and I would suggest that you expand that to include children.
We could put that in the, do we want to put that on the children's, do a specific one for children, or just leave that in there and include all three? Elliot, what do you think?
I like the idea of making it broad if we see as across the region that there is a need across multiple populations, because it's not like the need is very different. So I think we can use one need to elevate an issue across multiple populations in this case. So I think if we want to talk about, I don't know, affordable recovery housing, and we can specifically mention children, adults, and older adults and parents with children or something like that. So we can be very clear that we're saying this is an issue across the board. And I think this may be more unique in our region than some others, that we really need affordable housing for folks. And I think we need both supported housing and independent housing options.
Yeah, I agree, Elliot. Because when I just looking at it, I think about, we talk a lot about the group homes that don't contracting care and the struggles that they face with staying operational. That's a group home that could, with additional support, house someone who's medically fragile, or house someone who is elderly, potentially house somebody who has like a single person with kids. So I think you're right, keeping it broad with us knowing, like, in mind the need that we do have that can be fulfilled with this.
And then my question would be, should we go ahead and do one for the MH side on housing in this way, if we're describing, and one for the substance use side?
I would say be careful on that one, because we're going to run out of needs. So I think it's possible. Are there any other mental health needs here that we want, that the adult committee wants our group to consider, or you think that's the main one?
I think case management wraparound was a big one, but I'd like to hear from other people.
I think the case management and wraparound's a big one too. I would prefer to not do the housing on the substance abuse side, just because that has been an area where there has been more funding, and I feel like some of our housing providers has moved because of that. They have moved away from serving those with the more significant health needs, and only focusing on those that are in recovery from substance abuse, that are able to get out and work and don't need as much of that daily support.
I'm in agreement there with Shar. Is anybody else in agreement? And I see heads nodding occasionally.
Yeah, I agree. This is Evelyn. I agree. And I think looking at the case management wraparound is something that's really important, because there is a lack of resources out there right now. And the case management is a resource to the homes and to everybody. So anyway, we can increase what they do, and increase them. And go back to the workforce thing. It's just such a shortage of them right now. But any kind of expansion on what can happen with case management would be great.
Yeah, there's a workforce shortage, but then there's also, that we've seen with the implementation of THL, there's been decreased opportunity for providers who are interested to be able to provide that case management, kind of traditional case management that a lot of our folks need. And we've got that we have that on the mental health side as well as the substance abuse side, which I know would look very different. So how do you guys feel about like including having both of those included in the discussion, the substance abuse, case management, and the mental health.
I think it sounds fair. I just want to make sure people are aware that the behavioral health children's safety net can actually help folks get linked up, if I'm not mistaken, and someone please from the department correct me if I'm wrong, with case management services if they're not eligible for other type similar services with other insurers. I know that they've been looking for ways to spend those funds. So the children's population, on at least on the mental health side, hopefully is mostly covered with this. On the adult side, if we're talking about increased case management, we're talking about either appealing to TennCare, which is a separate department, or we're talking about increasing safety net funds, unless the group is looking at something different.
Well, that's interesting. I didn't think about that with safety nets. So I know for me, the people I think about are those who are not eligible for TennCare. So then safety net would be the direction I think that this would need to go in.
And that's fine if we think we need to do increased safety net funds, but of course we'd want to be able to show that they're all being spent somehow, or at least in our region that they are. And I know that gets challenging, but I think it's a good idea. We got a few more minutes. On the bit, I don't know where we are, but just for the sake of time, and I don't want to be the only one talking. I hope others can speak up, but I really feel like we have a huge need for more access to buprenorphine treatment, regardless of payer, in Davidson County. I'm just speaking to, across the state very much. There's huge problems with access. We're actually doing, Behavioral Health Foundation is doing a study of pharmacies right now. And what we're getting back in our early data, coming back from phone calls we're making, is awful. Like, people can't get their, even if they get a prescription, they can't pick it up hardly anywhere. But we've got to at least have folks, and I'm really appreciative of the department's announcement recently that they are pursuing partnerships with hospitals in collaboration with Tennessee Hospital Association, if I'm not mistaken, to start offering medication-assisted treatment access in emergency departments and piloting that. I think it would be worth our while to rubber stamp that and say we want to see that in our region, and I think we need to see a lot of it. So that's one way, or some other way to get same-day access to induction for medication-assisted treatment.
Any of those head nods want to speak up in information?
Everybody's so quiet this meeting.
I totally agree with you, Elliot. But I see some, and with this, you can't always see the screen, everybody on the screen either because of the document. But I see heads nodding. They're quiet. They're nodding.
I agree with that too.
That sounds like a big one.
And the only other need I wanted to raise just quickly is if there's not a third need for substance use that we are clear on, and I'm not saying there's not, but there's something that's come up in some other groups in Tennessee regarding helping folks with addiction disorders gain meaningful employment and working with employers as well. There is supported employment programming on the mental health side with the department. There is none specific or focusing on substance use disorders. And I know there's interest from folks doing some of this work with the department, and maybe we can help them elevate that as something to look for funding for and coordinate. So just something to consider. It would be like addiction or recovery-friendly workplaces, and maybe we could, it crosses both sides. And that's it. I'll be quiet.
Elliot, where are we with the fentanyl test strips? That was this one the governor agreed to look at, right?
Yes, and I thought that was one in here. That's why I was trying not to say it in the adult stuff. But we hope that bill, being an administration bill that the governor is recommending and asking his leadership to help move, will be that it will pass. We can't say for sure that it will. We can't say that it will pass as it's intended, but we certainly need to ramp up distribution quickly. That would be a wonderful need to say that we need to increase. We need to have distribution of fentanyl test strips and other harm reduction. So naloxone, fentanyl test strips, we could wrap it all into one if folks are interested. That would be another good need as I see it.
I'm good with having that one identified.
I am too.
Me as well.
Me too.
That's great.
I agree with that too.
And where are we? The other one I'll bring up is the same day access to establish outpatient intake therapy and med management through traditional and non-traditional mental health resources. How important is that to people?
Shara equated that to workforce, if I'm not mistaken, and said that kind of falls under that.
Okay. I'm a little worried about that. Getting mental health recovery. Okay. So we got 3 and 3.
I have a list if you want me to recap, but I may not have everything. Would you like me to, Shara?
Yeah, if you'll read your list, and I want to compare it with what I've got, and then we can figure out if there's anything missing.
Yeah, I've got four on each one that could go both ways. So maybe technically 5 on one. On the mental health side, recovery housing and group homes for all ages, respite care focused on children and parents. The workforce initiatives that we talked about that were not funded in the governor's budget. And then we talked about case management, which would be increasing safety net. And that also includes wraparound services and peer support. That's a lot in one. On the substance use side, I have case management for substance use disorder, same day access to MAT, recovery friendly workplaces, and then distribution of fentanyl test strips, naloxone, and other harm reduction.
And is that what Rusty has? Because he's keeping the minutes.
As best I can.
Did I miss anything?
That's what I've got too. Excuse me.
That's you. Okay. So based with the limited time we have left, based on that information, guys, are those the things we want to go with? And what did the adult committee and the children's committee may have some things left over that, or again, are they included in? We've got children covered in here, and we've got adults covered in here. So, Avis, how does it look for us as a region? I mean, if we just do this in a lump sum as our total, asks basically for needs assessment, or should we ferret any out that are specific to those committees?
I think we need to get down to 3 and 3. We're at 4 and 4 right now.
So, you're looking at your time, if you're going to stay over a little bit, or if you're going to adjourn as 1 o'clock, then you would need to flesh out those 3 and 3 and do a email vote with a count, and then the majority, and then send it to us, the state, as your final needs. If you're going to do that now very quickly, it would need to, if you're sure on the needs that you want to vote on, then you can do that vote now, and we have to do that vote by a yes or no or abstain, and then the majority would carry the vote, and that motion and that vote would be approved, if that's how you want to do it before you end the meeting today.
Okay.
I believe we could probably do this in 5 minutes, but it's up to Shara and others. I'm happy to help if you'd like.
Yeah, I'm with Elliot and Shara. It's your ball game.
Yeah, ditto. I say let's do it. Well, we've got most everybody's still hanging on. Yeah.
All right, I would suggest to take the vote that someone read off the 3 for substance abuse and 3 for mental health that you are proposing to be adopted, and then say, I make a motion to adopt these as the work of the committee. We'd need a second, and then we can do the roll call vote. So
And then-
Shara, can you read off the 3 and 3 that you are proposing will be the work of the council?
We have to.
And then make a motion.
We have 4. We got to work down to 3 real quick, Kurt.
Yeah.
Okay. All right.
Let me make that decision.
I have a suggestion, Shara. So on the mental health side, there was a lot of energy around housing and workforce from everyone. The 2 that had less energy are respite care and the case management, wraparound services, and peers. I think when you get into peers, that's a whole different ballgame, quite frankly. And I mean, it's not that that's not important. I just think it's not the same. Should we just stick with housing, respite care, and workforce, or do people think that case management and increasing safety net's more important?
I think case management's more important.
You thought was too. Here's my thinking. The housing is a huge issue. And if we can start there, that will increase some supports. Like there'll be like a ripple effect. And then, next year we can take a look again to see what does it look like as far as the case management type of support, peer supports. So I would suggest also the workforce, the child respite, and the mental health housing.
And then and again, I'm not trying to close that, but on the substance use side, case management for substance use is a very interesting one. It's not something that really quite exists as the service that folks might think about. It's certainly very interesting. I think same-day access to MAT, there was a lot of energy around, and then fentanyl test strips, naloxone, harm reduction, a lot of energy. So I think we're deciding between case management for substance use disorder, which would be a new framework to develop, or the supported employment, recovery-friendly workplaces on the addiction side, and to do some education and programming and get programs to get folks employed and keep employment. So it's really down to case management for substance use disorders or recovery-friendly workplaces and supported employment on that side.
And you guys on the substance abuse side, I mean, case management, what's that mean to you? I mean, we need to hear from you guys. We need to hear some talk really, really quickly though. What do you think?
This is Patrick. I hadn't said anything the whole meeting, but I like the case management on the mental health side more opposed to the substance abuse side. There's a desperate need for the case management and assistance for in the housing category. So,
and then we do. Dalmas did comment for the supportive employment just now also.
Hi, this is Maria. I also think we have to do an education as well around supportive employment. I think people are aware, but they don't know the moving parts. And so supportive employment has been around for a very long time. It's not a new issue. It was on the developmental side. And so the conversations with our providers and utilizing, I think they are using it, but here again, that's education. I think everybody has a different definition around case management, what a case management does, and what finding resources in the area. And for me to hear that Davidson County is short on resources, I'm kind of cringing. They have plentiful resources. I think case managers don't know where those resources are. And that's a different conversation.
Yeah, we have the Lifeline programs and these navigators and things. Again, not enough time to go into them, but those are quasi case management type of programs on the substance use side. Is there any supported employment for substance use disorder specifically in this area? I'm not aware, Maria.
No, I think people are utilizing that services through the
IPS
with individuals that they come across that would support who are dually diagnosed.
Gotcha.
Okay. And so, yes, they are utilizing it, and I will leave it at that framework. But I do know of folks that are who are on the substance use side who also carry mental health and substance use that are getting into those services.
Great.
You know, I agree with Maria. The education is a very valuable point when we're talking about the supportive employment. The reason I say is because if their individual is not educated on how many hours they can work or how much money they can make along with their Social Security, they're being dropped from Social Security or Social Security disability income. I've seen it with several people here recently that they started working and wasn't educated about the amount of money that they can still make and be within the guidelines of Social Security. Their Social Security was dropped, and it takes 30, 60, 90 days for them to get their Social Security started back once it's proven that they're working within the amount of hours that they are allowed to. So education is going to be a very, very valuable piece with supportive employment.
So does it look like we have a consensus with at least 3 on each side?
I think, but it's not unanimous. But on mental health, and again, if I'm wrong, just please correct me. What I'm hearing from everyone: housing and group homes, respite care, and workforce. On the substance use side, same-day access to MAT, recovery-friendly workplaces and supported employment, and education can certainly be part of that. And then fentanyl test strips, naloxone, harm reduction. I know not everybody's going to be thrilled with that, but does that capture the majority?
That's what it sounded like to me. Excuse me. Sorry, I don't know where my voice went.
I'd be happy to make a motion to adopt those 6 needs assessment topics to be put onto worksheets and submitted to the department on behalf of Region 4.
That's awesome.
Do we need a second?
Second.
Second. Who's got to make a second? Did you make that, Shara, or someone else?
This is Evelyn. I'll second.
Okay. Now we're at the point. We have a motion and a second, so we're at the point where we need a vote. So either Kirby or Rusty can go down the list to do a vote, yes, no, abstain.
Rusty, I'll go down the list if you don't mind to just keep a tally, and then we can read the votes at the end, the total.
Sure thing.
Okay. Kirby Phi, abstain. Avis Easley, abstain. Linda Brown, yes, no, or abstain.
Yes.
Thank you. Dalmas Sanchez, yes, no, or abstain.
Yes.
Thank you. Dawn, and I still forget how to pronounce your last
Come on,
name.
at least try.
I was like, Liacano.
It's Liacano, and no.
Is it yes, no, or abstain?
No.
Okay. Elliot Pinsley, yes, no, or abstain?
Yes.
Evelyn Jurgen, yes, no, or abstain?
Yes.
Haley Hershey, yes, no, or abstain?
Yes.
Cooper or Cal Bryant, abstain. Kurt Hippel, abstain. Maria Smith, yes, no, or abstain?
Yes.
Okay, she put yes in the chat. Thank you.
Mhm.
Patrick Starnes, yes, no, or abstain?
Yes.
Thank you. Michaela Poisner, yes, no, or abstain? Yeah, okay, she wrote yes in the chat feature. Thank you. Rama Muhammad, yes, no, or abstain? Rama? Okay, Robin Nobling, yes, no, or abstain?
Yes.
Shara Biggs, yes, no, or abstain?
Yes.
Stacy Yarbrough, yes, no, or abstain?
Yes.
Susan Cope, yes, no, or abstain?
Yes.
Susan Me, I believe you wrote yes in the chat.
Yes.
Rusty Emerson, yes, no, or abstain?
Abstain.
Okay. Tristan Petty, yes, no, or abstain?
Yes.
Yes, thank you. And Willie Ross, yes, no, or abstain? Well, it looks like she's not at her desk. What is the total that we have? Rusty?
Looks like 17 and 1.
Okay.
And Rusty, I'm sorry, this is Avis. I was counting along with you. I have 18 and 1.
You are probably right then. I'm just doing a quick add as we go along. So
I have 18 yes, 1 no, and 5 abstain.
Okay, thank you.
Okay, at that point, Shara, are you still with us?
Yes, I'm here.
Okay, since we have a majority of yes at a total of 13, then as chair, you can proceed with indicating that the vote, the majority, and that you can proceed on as chair saying that the majority has ruled with the vote.
Okay. So the majority has ruled with a vote. I'm so sorry, y'all, for proceeding with the priorities of workforce development, child respite, mental health housing, same-day MAT, recovery-friendly employment, and increased harm reduction.
And yes, and we can share, I can help with some of these. And then we might want to talk with our committee chairs and figure out who can write which ones. And we've already got the workforce one that we can recycle and just add a little bit to.
Yes. Yes. So again, the work on this is going to continue. So as we are drafting this out, we may reach out for feedback, review, that kind of thing. So yes, please continue to stay involved with us. Again, so it's not falling on just a handful of people, as Robin mentioned before. And then we're done with that piece. We have gone over 13 minutes is what I'm showing. Our next meeting is Wednesday, May 4th. I have format to be determined, but likely virtual again. Invitation, agenda, all of the things will be sent out ahead of time. Any last minute, very quick business that we want to include before we adjourn?
I made an announcement in the chat about an event tomorrow, bringing in the Cahoots folks to talk about the model they do for crisis response without law enforcement when calls come to 911. So if anybody didn't see that, check that out before you leave. But that's all I want to say. Make sure people saw that.
Awesome. Thank you. All right. Can I have a motion to adjourn the meeting?
So moved.
Thank you, Elliot. And second?
I'll second it, Don.
Thank you, Don. All right. Thank you guys again for hanging in there. Kirby, Avis, thank you also for your guidance. So much appreciated. I hope everybody has a great rest of the day and look forward to further discussion on these needs assessments.
Thank you, Shara. Thanks, everybody. Have a great day.
Same to you. Thank you.
Thank you.
bye.
Thanks, everybody.
Thanks.